how does understanding our own attachment styles how can that impact our relationships?
Well, if someone grows up in an environment where love and affection was dependent, or it was unpredictable, maybe there's trauma, that's going to cause an insecure attachment style.
Welcome to Patient in the Room. I'm Megan Ferguson, and today I'm joined by Zoe Laxton, a psychotherapist. Zoe, welcome. How are you?
Hi. Yeah, I'm really good, thank you. How are you?
Good, thank you. It's great to have you here.
Yeah, thank you for having me on. It's good to be here.
So you're currently completing your doctorate in counselling, psychology and psychotherapy. Is that correct?
Yep, I'm in my final year.
Amazing. And could you tell us what psychology and psychotherapy is and that entails?
Yeah, of course. So psychotherapy essentially it's a collaborative relationship. Mm-hmm. People come to therapy often, wanting to explore different patterns or sort of find deeper meaning or understanding why they behave the way they behave.
Yeah.
They might be, behaving in certain ways that are not serving them, or having really intense emotions, or just wanting sort of a deeper exploration. And so people come for various different reasons. It's about a collaboration and a partnership, and that's what's really important. And so in my doctorate, so I'm in my final year, and my research is on emotionally unstable personality disorder, otherwise known as borderline personality disorder, and the fear of abandonment. Okay. And looking at new ways that we could possibly apply findings to psychotherapy as well, because fear of abandonment is a huge catalyst for other behaviours and symptoms associated with the diagnosis. So.
Could you describe some of those behaviours that you might see on the back of that? Yeah,
of course. So often people with EUPD or BPD experience emotions really, really intensely. Yeah. Quite often anger as well. Anger is a big, big thing. And as well, often they might engage in risky behaviours such as substance abuse, or risky behaviours, unsafe sex. And again, intense fear of abandonment. As well, they often have quite an unstable sense of who they are and their identity. Okay. And so they're all different, basically different things, how they relate to others, how they relate to themselves. And this can cause turmoil. Complete turmoil for them. And before it was actually thought to be treatment resistant, and sometimes some people do think that it is. However, it's shown that with dialectical behavioural therapy, DBT, it's actually, the recovery rate is phenomenal. It really is, and it's fascinating just to actually see the change. And I work at Schoen Clinic in Chelsea. Yeah, so we at the Doctify event. Yeah. And I also work for DBT UK, which is a comprehensive DBT comprehensive DBT program. Could you
explain to me what DBT is and what it stands for?
Yeah, of course. So DBT stands for Dialectical Behaviour Therapy. Yeah. And what essentially it does is so there are 4 different sort of modules, so to speak. So there's mindfulness, and mindfulness as well. Often people can think of mindfulness being really zen and things like that. No. It's not always like that at all. Essentially what it is helping us stay grounded and in the present, so we can be able to actually respond maybe effectively to uncomfortable situations when they do arise for all of us, but really being present in the moment, for example, engaging in the 5 senses. Yeah. There are different ways, we have different skills within mindfulness as well. So that is basically the fundamental crux of DBT. And then we have distress tolerance. So distress tolerance, these are firefighting skills. And so, for example, if someone is outside what we call the window of tolerance, they're likely to engage in, what we would call in DBT target behaviours. So what we do is to actually de-escalate, the intensity of the emotion and so, for example, there's a skill called TIP, which is basically temperature. So us as mammals, we have the mammalian dive reflex. So by putting your head in an ice cold bucket of water, which is so uncomfortable, however,
I can imagine,
it completely lowers your heart rate, and then actually you're less likely to engage in target behaviour.
Interesting.
And then we have interpersonal effectiveness. So that's how we communicate with people. Because some people as well will either be a completely bulldozer communicator or a complete doormat. And it's about helping people understand what type of communicator they are, and then different skills in terms of how we can improve how we relate to others and, essentially, have healthy relationships with other people. And then as well, so then we have the emotion regulation as well. And that essentially is, regulating our emotions, which is really, really helpful in different skills like that. So we have mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. And what I love about DBT as well, it's amazing because you see on MRIs, before DBT, especially before mindfulness, they've shown as well that the amygdala, which is basically, kind of the smoke detector emotion part, is like really, really activated. And then the prefrontal cortex, I suppose, part of like the thinking brain, is much less like activated than, for example, like a normal person, so to speak. But however, after just doing mindfulness, and especially, for the whole like DBT program, it's shown as well that how the amygdala activity has completely decreased and the prefrontal cortex activity has increased when they've shown people distressing images. So it's fascinating to show that it is also like, neuroscience backed.
Yeah.
Yeah.
Interesting. And I guess like you kind of touched on emotions there and kind of like regulating those emotions. Is there kind of like part of your role is to maybe help the client like identify what those emotions are? Because I feel like sometimes, even for myself, sometimes I'll be feeling like, and I don't quite know what that emotion is. So like, I feel like putting a name to that emotion is quite difficult sometimes.
Oh, absolutely, 100%. And that's why a lot of what we do as well, a lot of what I do as well is, education around emotions. So for example, looking at the biosocial models. So for example, we have biological vulnerability. That's things like genetics, brain structure. And then we have the social, for example, it could be things like childhood trauma, bullying at school, like social, basically, essentially elements, because emotion dysregulation it needs those two sort of things. And that actually then turns out to be emotion dysregulation, which we see as problematic behaviors such as self-harming, intense anger. So what we do as well is, education around emotions in terms of someone might not actually be able to label how they're feeling, but respond in like ways that are really problematic. So often as well, anger is a very physically felt emotion. So what we do, or what I do as well, is basically help people to identify and pinpoint what they're feeling. So they might start to notice that their heart rate increases. They might start to notice that perhaps they, are starting to feel quite hot, starting to, potentially even shake.
Yeah.
And noticing these and labeling it and noticing when I'm really experiencing this emotion intensely, we can then employ skills to actually, decrease the intensity of the emotion and engaging in problematic behaviors. So helping people understand how they're feeling and also why they're feeling like that can help you relate to others in a more, effective way. And as Marshall Linehan says, who is the, creator of DBT, building a life worth living.
Yeah, absolutely. And I guess kind of like, so, we've kind of looked at therapy here. We've kind of talked about DBT. How does that relate to CBT? And like, what's the difference between DBT and CBT? And could you kind of like explain what CBT is to us?
Yeah, absolutely. So CBT is cognitive behavioral therapy. So CBT basically looks at, again, it has practical, taught and exercises and behavior change.
Yeah.
So it's looking at between how your like thoughts, like emotions, feelings, behaviors and things like that change. However, with DBT, it balances acceptance and change and also validation. Because again, lots of people who are emotionally dysregulated, if they are in, a really emotional state of mind, they're often unable to think in a rational way. So that's where we sort of have the skills, and that's the sort of, so it's DBT is a third wave. So it's an extension on CBT, but it incorporates validation and change as well. CBT does incorporate change as well.
Yeah.
But with DBT, it is also about acceptance as well as things, accepting our emotional responses and also being able to choose how we respond to them. So they are both behavioural therapies, but that's the difference as well.
I imagine some people come to therapy kind of looking for practical tools. Like maybe some other people like search for some deeper understanding about themselves, about maybe like family members, friendships, different relationships that they might keep. So how do you kind of like balance that short-term techniques with those maybe longer-term, deeper looks at kind of like their life and their relationships?
Absolutely, and that's where integrative psychotherapy comes in, because it's not a one-size-fits-all. It's not, and although you can practice different approaches by themselves, what integrative psychotherapy does is it tailors it to each person in front of me. So what I will do as well is look at what the person is wanting from therapy. But if they come to me in crisis, I will start maybe looking at a skills-based approach of how they can manage these, for example, maybe behavioural issues or really intense levels of anxiety or anger, and sort of have a skills-based or maybe problem-solving approach for the there and then.
Yeah.
And then often then I can go into a deeper sort of work, maybe look at things of like meaning. What is meaning? What do I want from life? What do my relationships with other people look like? Where am I in the world? Who am I? And looking at deeper things like that, or how, for example, childhood experiences or like attachment patterns as well show up in later life, and sort of maybe understanding why. And then when we understand why, we can then foster change as well.
Fascinating. And I guess kind of like touching on that, do you find a lot of things that you kind of work with adults when they're kind of looking a little bit deeper, perhaps? Do you find a lot of the root of those feelings come from something that happened in childhood, or they kind of like younger, more formative years?
I think it depends. Quite often, yes, I have found that. Definitely, when looking at different types of attachment styles and how they show up in, adult relationships, that is a big thing as well. So we're sort of peeling everything back and like going back to things in childhood. Attachment's basically how we, relate to others and things like that, and understanding potentially why. And once you understand why, and then you have the therapeutic, space as a sort of safe space. Well, it is a safe space. To then sort of model a sort of secure attachment if someone might not have had that, and then also then applying it in the outside, outside of the therapy room. So, for example, someone with an anxious attachment style might feel really, really nervous that their partner hasn't actually messaged them, and then they could, for example, I have a particular client I'm thinking of who was really, really nervous when her partner wouldn't text her back, so she started calling really, really, calling quite obsessively in her words as well. And because she was terrified that he was going to leave her. But paradoxically, when we behave in that way, it's actually more likely for what we fear to occur, because, it's quite overwhelming. She was looking for that sort of, assurance. But then we look at the situation of that's what we fear, but we don't. But in this case, she didn't actually have anything to go on. And this reassurance seeking was building this fear as well. So by sort of resisting that urge as well, and learning that, relationships can be safe. People can be trusted. Not everyone is going to abandon and leave you. And, she'd say things like, oh, are we okay? Oh, I'm 5 minutes late. Are we still going to have our sessions in future? And it's again a lot of, let's just notice what's going on here.
So what I'm hearing from that is it's a lot of kind of the client will come and kind of talk to you about something that might be happening in their life, how they're feeling about something, and you'll kind of reflect that back on them and kind of say like, so let's notice what's happening here. How are you feeling around this? And kind of like a lot of the answers maybe come from the client themselves.
Again, so we can sort of, again, it's about, exploring these things together as well, and seeing what the client notices. Basically sort of maybe unraveling and looking at why, and then how, when we understand the why, what can we potentially do to change that if it's something that we want to change. That
must be such a interesting journey to go on with people, kind of like watching them grow and discover new parts of themselves. And I guess looking deeper within yourself, that can be quite a terrifying thought. Do you kind of like help people, help people along that journey with looking deeper in themselves? And like, if someone was nervous about kind of what that might bring up for them, kind of what would you say to them?
Well, you know, and again, it is actually can be terrifying as well. And I wouldn't push. I mean, I like to challenge, you know, but again, it's as and where appropriate. And you would never sort of push someone where it would be detrimental to themselves. And again, when we work over longer term, we take our time. You know, it's meant to be, you know, it's a healing space. And if someone's not ready and pushing them into something, you know, I can have a sort of hypothesis or like, you know, case formulation. However, it's unlikely that's going to be beneficial to the client if I start saying that earlier. So we're sort of, again, building trust and safety in the space as well. And that takes time. And again, then when we sort of feel ready, we can start to go into maybe the more difficult things, emotional experiences. Or again, it depends on the type of person, depends on the type of approach that I'm using as well. So again, it is unique to the person. And when I work integratively, it's unique in terms of how I do that.
Interesting. And so you work a lot with attachment and relationships. How does understanding our own attachment styles how can that impact our relationships, whether that be with partners, parents, friends, like whatever relationship that would be?
Yeah, absolutely. So when we can understand maybe why we behave in certain ways, we can then foster to change that. So, for example, if someone grows up in an environment where you know love and affection was dependent, or it was unpredictable, maybe there's trauma, that's going to cause an insecure attachment style. And then that shows up in kind of how we relate to others as well, because if it's, you know, people aren't safe, we're going to behave in ways that sort of are unsafe. So then there can be, as I was saying before, you know, obsessive communication or pulling away or completely avoiding because I can only trust myself, I can't trust you. Or then the push-pull, which is like a disorganized attachment. So, you know, coming really close and then pulling away. And by understanding this and where these patterns came from, we can sort of remodel in the space and then apply it to outside. Because, yeah, as I was saying, when we understand why, and often by understanding the why, it would be because this isn't serving us. And then once the understanding's happened, we can then foster the change.
And when we kind of are working towards that change, are they kind of like practical examples, like practical things that we can do to foster change? How do we change that kind of mindset?
Well, I mean, it depends because, again, if we have the skills-based approaches, for example, if with anger we do things as well to, like, for example, the acting opposite to what the emotion, if anger is telling us to attack, we can then sort of approach gently. So that is sort of the, the sort of skills-based way of doing it. Yeah. But then as well, understanding ourselves in terms of like a deeper level of why we do things or how we relate in certain ways. That's basically, so yeah, it's skills-based, but also deep understanding. That depends.
Yeah. And you kind of touch on anger there as an emotion you work with a lot. So when we're kind of like talking about anger, I guess that's a really difficult emotion because when you're in that kind of angry state, you know, like for me, I think, especially when I was younger, I kind of just saw red, you know, and like I didn't feel that I was as in control of myself as maybe I would like to have been. So yeah, like do you find when you are in these sessions with people that sometimes we kind of have to like draw it back and like take note of how they're feeling, give them that guidance, but do you find sometimes you kind of have to go, actually, let's just take a break for a second and then we'll kind of discuss that feeling again?
Yeah, absolutely. And the thing is, if strong emotions arise during sessions, we label them, you know, what's going on for us right now. Getting in touch with our body, doing some sort of, you know, maybe mindfulness things of what am I experiencing right now? I'm noticing that I'm having something really intense.
Yeah.
Can I respond to this in an effective way? And again, so in session, we can deal with strong emotions when they arise, but then also looking at throughout the week what happened, for example, when you experienced an emotion really intensely, how did I respond to that, or how did I react to that? And what we want to do is to be able to respond to emotions, not react to them, because that can be really problematic, actually. So again, it's basically looking at the different emotions, how we basically experience them. And so, yeah, I love working with intense emotions, decreasing the intensity, and giving practical skills for that.
Yeah, interesting. I find as well, like, it must be so interesting kind of talking to that person, giving them those practical kind of tips. But I guess, like, when they're actually in that situation, in that, you know, you're arguing with your partner, say, when you do feel anger, I think it's amazing that you kind of notice how you're feeling, respond to that appropriately. But then how do we kind of draw in if that partner is responding in anger as well? You know, de-escalating not just your emotions, but potentially someone else's as well?
So again, we are responsible for our own emotions, and we can't, control how other people behave and react. However, we can respond in certain ways that make it more likely that another person is going to act in a favourable or unfavourable way in terms of response to us. So what we do as well is when you're in a completely emotional mind, you're not going to be behaving in a way that's actually going to benefit you. So teach things like just to stop, and practicing those skills. So stop is, the S stands for quite literally stop. And then, because Marsha Linehan loves an acronym, T is take a step back. And then O is observing. So observing, for example, I've got a really, really intense emotion right now. And thinking, what's going on in my body right now? I'm noticing what's going on around me. And then the P is proceeding mindfully in a way that is going to be effective for us, because the thing is, in that moment, I'm not going to behave in a way that's actually going to be particularly effective. So by literally stopping and freeze, it's almost like buying time and actually going to respond in a way that's going to be more appropriate. And again, how we feel is always valid, but how we feel might not actually match the facts of the situation, and that the intensity of that emotion might not actually fit the situation. So kind of taking a step back and realising that is like, okay, fine, how do I do this effectively?
Yeah, it's really interesting. I think like just taking a step back sometimes, just generally,
even physically, they say literally physically taking a step back.
Yeah, definitely. And I guess like, so people might come to you, they're having a really difficult time in life, or something massive has happened in their life, whether that's like a new job, they're moving country, like whatever that is, or like during a period of kind of like burnout or something. How do you help people kind of reconnect to themselves and to meaning, I guess? So
first of all, I mean, I'd ask I'd sort of be like, what do they want from life? Because if someone's feeling burnt out, stressed or stuck, they might not actually even realise that, but they can realise that something's not right. They need some help with something. So what I'll do is I will look at what's working for them in their life, what's not working, what are their values, what's holding them back. Is there something, is there sort of like a big life transition, like you said, like a new job? Looking at how we can sort of navigate that, and in a way that is actually going to be helpful for us. And again, exploring this and sort of how to manage difficult life changes, how to make sense of them, how to basically, sort of live in a way that is going to be meaningful and also effective for us. So those are different things of how I would work with people. And then burnout, we would look at different things, like, because we only have so much energy. Yeah. And the classic thing of burnout as well is first of, I need to do more. I need to do more. But again, we only have so much emotional energy, and we have to put ourselves first before we, in caring professions as well. Self-care is paramount. It really is, because you can't pour from an empty cup. So again, about people with burnout, we'll look at how can we manage this? How can I put in boundaries? How can I look after myself in order to basically work effectively, have like a meaningful life, while also, attending to myself as well. Because so often people, we neglect ourselves without even realising it. And we will sort of be carrying on and kicking the can down the road until we really are at complete burnout.
Yeah, definitely. And I guess like around the point of burnout, so obviously in today's world, and I mean forever, right, that people expect more and more and more and more of us. Do you have like some practical tips that you could share with me for like, if you are feeling burnout and you recognize that, what could be a first step to kind of shifting that direction?
I think as well as sort of, looking at our priorities.
Yeah.
Because we can't give 100% to everything if we take too much on, because otherwise we're spinning plates and then it's not looking good for us. So I think by checking in with yourself, again, self-care.
Yeah.
And again, if you start to notice maybe you're being a bit more irritable, feeling tired, you might be, drinking more than usual, disrupted sleep, could be sort of forgetting things, stuff like that. Relationships could be suffering. Is looking at things as well of like, okay, how can I prioritize certain things? What is important to me? What are some non-negotiables? And am I as well, perhaps, am I not putting in boundaries effectively? Am I being a yes man and saying yes to everything? And then I end up doing 50% of everything and 100% of nothing.
Yeah. And
noticing as well, being really sort of like boundaried, clear, noticing what's important and maybe what isn't as important, and sort of rejigging those things, because we only have a certain amount of life and emotional energy within us. So that's what we'd look at. So it'd be practical strategies, and lots of, again, compassion, lots of understanding, lots of validation as well.
And in terms of kind of like setting boundaries, realizing boundaries, do you have any, again, practical tips for people when trying to put in those boundaries?
Yeah, so I think you've got to realize what your boundaries are, first of all, and noticing, and again, emotions like, so for example, anger. Anger occurs when boundaries have been crossed. Yeah, boundaries have been crossed. Oh, there's something's gone against my values that I'm not happy with. So by looking at, okay, for example, how am I feeling about this? And noticing, okay, what do I need to say no to? Because if you're constantly, for example, saying yes to your boss, yes, and it's actually, negatively impacting on you, is thinking, okay, what can I and what can't I manage? Yeah. And it's not about bulldozing the other person, saying, oh, I'm not doing this, I'm not doing that. But it's like, I can't actually do this right now. And I think just being open, authentic and honest before we start, kicking the can down the road until we are really at complete burnout, but just checking in with ourselves and, really sort of what's going on for me right now, rather than sort of brushing it under the carpet, which is so common to do. And burnout, I mean, the amount of burnout we see is huge. Yeah.
I guess like some people, they might write diaries or reflection journals. There's like apps, so many apps out there for this kind of stuff. Is there anything like that you'd recommend people do kind of like on a regular basis to keep checking in with themselves?
I think it's always great to sort of, have like maybe 10 minutes a day to check in with yourself. Some gratitude as well, what you're grateful for. If something sort of like upset you throughout the day, why did that upset you? How could you maybe deal with things differently? Why am I feeling this way? And journaling, I think, is a really, really great thing to do. And as well, self-care, being mindful of how we're feeling and checking in with yourself and sort of putting yourself first is so, so vital.
And I guess like with journaling, it can be quite difficult to know what to write about. Like I'm sure many people just like me have kind of sat down with the intention to journal, pen in hand, and gone like, I don't know what to say. Do you like have any like tips or anything that you would kind of like suggest to people if they're kind of sat there in that space wanting to write something? Where do we start?
Well, I guess I suppose it's kind of what do I want from this? Am I trying to understand what, how I'm feeling? Am I trying to check in with myself? I mean, start writing key points of the day, for example. Yeah. What went well for you that day? What didn't? How am I feeling? What emotion did I experience most today? What was linked to that and why? And then sort of, coming up with how emotions are, connected to our experiences and things like that. It's sort of, checking in with ourselves. And key points of the day or things that I want to do, things that I could do tomorrow. What's important to me? What did I notice that happened today? And things like that, yeah.
Interesting. To kind of end the session, I'd love to do like a quick fire round of questions.
Go for it.
If that's cool. No pressure. They're just kind of like fun little ones. Cool. So what's one word that kind of describes your approach to therapy?
Ooh, collaborative.
Okay, interesting. The best piece of advice you've ever received?
Quite a few, but again, you can't pour from an empty cup. I think it can sound a bit cliche, but it's so true. And reminding ourselves this it's so, so important. And another thing as well, what I like to say to clients as well is like, you are not your thoughts, and thoughts are just thoughts. And often we can look as thoughts as facts, and we've sort of created this, this scenario in our head that's actually not really based on any sort of evidence, so to speak. Yeah. And more often than not, this causes us quite a lot of distress. So it's by noticing that, I think, is really, really important.
What's your own kind of like personal self-care ritual?
So I practice mindfulness. I really like it. I think it's really good, and you can do it anywhere and with anything essentially. I also take my neighbour's dog for long walks, which I absolutely love him. He's brilliant. Now he's got an anxious attachment style. He's so needy. And that's what I do basically. And also checking in with myself, like, how am I feeling today in myself? Did something irritate me? Why did that irritate me? Have I had a really good day? And sort of kind of noticing and really, really checking and being with myself. Yeah. That's my self-care routine. And hot baths as well. Love that. Just, kind of could sound a bit cliche, but it really does make a difference and it does work. So
I absolutely love a hot bath. Yeah. Absolutely. Well, Zoe, thank you so much for being on Patient in the Room. It's been an absolute privilege having you here.
Thank you so much for having me. It's been really nice.
If you enjoyed today's episode, please follow and share Patient in the Room wherever you get your podcasts. We'll be back soon with more conversations.